Hello again, this is Dr. Michael Harris. Mitch is here with me today. We're going to offer you some additional ideas about managing your chronic pain. Today the focus will be on the idea of managing your pain using your own toolbox. As is the case with any complicated problem, having the right tools and knowing how to use them offers the solution to a successful outcome. And that is exactly the case with managing chronic pain. It's rare that any one of you or any one of us is able to find a single method that works completely and every time for managing our pain. It just doesn't happen very often. But the folks who do a good job over the long term have discovered that if they use 3 or 4 different techniques that have been tried by them and practiced by them, that together those tools can help people manage their pain in an acceptable way. In an earlier session, we talked a little bit about the idea of managing pain and how that affects the gates at the spinal cord. So today let's think about both this toolkit and the idea that what we're trying to do is to use the correct tools to close the gates as well as we can to allow us to move forward in our lives and work with as little pain as possible. The first tool to talk about in anyone's toolbox is breathing. Breathing is something we have with us all the time. It's something that we can use immediately in almost any circumstance, and it's been clearly demonstrated to have a number of physiological benefits that make it well worth spending a little time learning how to do good breathing. The second tool I want to talk about is a very powerful tool once it's been mastered and when it's used correctly, and that's the idea of mindfulness. We spend a lot of time focusing on what's happened in the past and yesterday, thinking about and worrying about what might happen tomorrow or next week. And a lot of the emotional distress we have and the stress, which exacerbates the pain, comes from this worrying about the past or the future. So mindfulness is essentially a tool that we use to allow ourselves to come into the present. Now, in the present, you have no responsibilities but to be calm and to pay attention to what's happening in your body. As thoughts come to you about tomorrow or yesterday, all you need to do is to gently acknowledge that they're there in your thinking and allow them to slip away and come back to the present. Here's another place where breathing is very important, and it can pull you right into the present by focusing on what's going on right now. The third tool in our toolbox as we look to build our ability to cope well with our pain has to do with sleeping. And when I talk about sleeping, I don't mean just getting 12 hours of nonstop sleep every night. Sleeping is something that is unique to each of us, and our bodies know about how much we need. When you have chronic pain, it is difficult to fall asleep and to stay asleep. We know that. And so there are some tips here I can give you that I think will help. Be sure that if you have activities planned during the day, you do them early in the day. Make sure also that when you eat your meals, you do it a little earlier in the evening rather than later. When we eat late, it loads our blood sugar up and causes our metabolism to accelerate a little bit. It's hard to go to sleep when your body is using sugar very actively. Also, you want to stay away from caffeine, coffee and caffeinated drinks late in the day. I wouldn't go past 3 or 4 in the afternoon drinking Diet Cokes or coffee, certainly. Cigarettes, actually, although they seem to be calming for a lot of us, I used to smoke, I remember. They are not, in fact, calming. Nicotine is a stimulant, and it actually accelerates the activity in your body and in your brain. So make sure that you pay attention to the rhythm of your day so that you are preparing your body for sleep in ways that I just mentioned. The fourth tool in the box has to do with aerobic activity and walking. Walking is probably the single best activity that any of you who have, especially who have low back, mid back, or neck pain, can do. There is something about the movement of the body that allows the back to exercise itself in ways that are helpful. And if you walk quickly enough, you can also begin to experience some of the benefits of aerobic activity. As we know from earlier talks, aerobic activity has a tendency to close those pain gates on the spine. Walking is a simple tool that you can use nearly any time. So we've got 4 or 5 tools in our box today. I would encourage you to try at least these 4 or 5 and look around to see if there are other things that might help you. Stretching, music, distraction. There are a whole list of things that can be useful in managing your pain. So good luck to you.